Hi, I'm Dr. Astha Dayal and I'm a gynecologist practicing in Gurgaon. I work at CK Birla Hospital in Sector 51 and I have my clinic in DLF Phase 1. So today we're going to talk about the 5 most common gynecological problems that women have. So gynecological problems are the problems related to the female reproductive organs, which means your uterus, ovaries, the mouth of the uterus, which is the cervix, the tubes, the sexual problems, urinary problems, period problems. These are all included into gynecological problems. The commonest problem that women face are period issues. A very common issue is painful periods, which is called dysmenorrhea, and it could be of different grades in different women. Then there are issues because of irregular periods. These can happen because of problems like fibroids or ovarian cysts. Another very common problem is PCOD, which is a hormonal imbalance involving irregular periods, hair growth on the face, acne, weight gain, and other metabolic problems. The third most common reason why women visit a gynecologist is because of fertility issues. If they're not able to conceive or if they're having problems in getting a pregnancy, that is called subfertility or infertility. Another common problem is abnormal vaginal discharge, which could be because of some infections, some sexually transmitted diseases, fungal infections, or some blood-stained discharge, which could be because of some other reasons. Another reason why women need to visit a gynecologist is when they are suffering from any kind of gynecological cancer, like cervical cancer, uterine cancer, ovarian cancer. And it is important that you visit your gynecologist regularly for screening of these cancers so that you can detect them very early and they can be managed with a good success rate. So patients usually come with complaints of abnormal vaginal discharge or with abnormal bleeding, which is irregular periods, delayed periods, intermenstrual bleeding, or bleeding after intercourse, or very painful or heavy periods. Or they could have problems with contraception, sexual issues, urinary tract infections, also problems like prolapse, like something coming down from the vagina. Then there are also regular screenings for which a patient comes to a gynecologist. Stress has a very big role in female hormones, and a lot of gynecological problems are related to stress. PCOS or PCOD is very commonly related to a stressful lifestyle, and improving stress improves in the hormonal imbalance of PCOS. Also, stress and anxiety is the most common cause of infertility. And whenever there is stress or any travel or change of lifestyle, it could also cause period irregularities. So when you come to a gynecologist, we inquire about your problem, but we also want to know about your period cycles. How often do you get your periods? Is the flow normal? Are they painful? Also about your sexual life, if you've had any unprotected intercourse, if you have any sexually transmitted infections, also if you've been trying for pregnancy or if you've had any unplanned pregnancies or the contraceptives that you're using. We also inquire about any urinary issues, any bowel issues, any weight issues, any contraceptive issues, and also if there's any other past or present illness for which you're on any medication. There is no particular age for visiting a gynecologist. You need to come to a gynecologist even as a young girl if you're having periods and you start having some issues because of that. Also for problems like urinary infections, vaginal discharge, which can happen in a young age also. But once you're sexually active, you should be visiting a gynecologist for regular pap smear testing every 3 years and a sexually transmitted disease screening every year. If you're sexually active, you need to get your pap smear from the age of 21 years onwards every 3 years. And if you're above the age of 30, you have to get it every 5 years as a co-testing of pap smear and HPV. To prevent the common gynecological conditions which are lifestyle related, you should have a good diet, less of junk food, low carbohydrate and a high protein and high antioxidant diet. You should get regular sleep, you should avoid stress, and you should practice some yoga, meditation or relaxation techniques. Also, you should have a good exercise regime to prevent all the lifestyle related conditions. And if you have any problem, you should be visiting your gynecologist soon, and also you should keep getting done your regular screenings for pap smear, sexually transmitted infections and for gynecological cancers.